Okay. Hi, good afternoon. My name is Victor Beltran, and with my classmates Alejandro Ibarra, Santiago Mesa, and Jorge Mocaví, we are going to present our disease prevention presentation. Okay, the introduction. We will compare our four essays that explore who has responsibility to help disease prevention. While some argue that governments should lead through regulation and public health systems, others emphasize the importance of individual ethics and personal responsibility. By examining these different perspectives, we aim to understand how both personal actions and public policies shape overall community health. Okay, now the essay number one, the main argument explains that the government should hold the primary responsibility for disease prevention, while individuals support through healthy lifestyles. The key evidence: governments possess resources to manage epidemics, vaccine distribution, and healthcare funding, who programs prevent millions of illness annually. And finally, personal actions matter, but cannot solve structural problems such as hospital underfunding.
Well, the essay 2, the main argument is disease prevention should be entirely the responsibility of the government, not individuals or families. The key evidence is that individuals cannot be expected to understand complex medical risks such as carcinogens, microplastics, and chemical exposure. Government regulations and protective systems are necessary to safeguard public health, and citizens should demand regulation through civic participation and political pressure. Next, the essay 3, the main argument is individuals and families should primarily be responsible for disease prevention, with the government providing secondary support. The key evidence is the WHO in 2024 reports chronic diseases are often preventable via exercise and diet. Lifestyle choices such as sugar reduction, physical activity significantly affect health, and communities could benefit from local health education workshops.
Now in essay 4, we see that the main argument consists that governments must lead disease prevention due to its scientific, technical, and organizational capabilities, while individuals contribute through cooperation. The main key evidences are that governments have access to uh, epidemiological data, diagnostic technology, and national health systems. Public services such as vaccination programs, sanitation, and food safety depend on governmental regulation, and many determinants of health, environment, water quality, healthcare access are structural rather than personal. The similarities and differences, or compare and contrast, are that Essay 1 and Essay 4 both argue that government should take lead, whereas Essay 3 argues that individuals and families should be primarily responsible, shifting emphasis to personal behavior. Essay 2 goes further than Essay 1, and Essay 4 insists that disease prevention should never rest on individuals, while Essay 1 and Essay 4 maintain that individuals still have a supporting role. Essay 2 focuses on environmental dangers and chemical exposure, whereas Essay 3 emphasizes lifestyle-related behaviors such as diet and exercise. Essay 1 and Essay 4 both acknowledge shared responsibility, although Essay 1 frames it as collaborative cooperation, while Essay 4 presents it as government-led scientific natural protection. Essay 3 emphasizes personal agency, whereas Essay 2 emphasizes citizen vulnerability and lack of knowledge, arguing individuals are not equipped to self-protect. Essay 1 supports a balanced model, while Essay 2 rejects balance entirely and demands total governmental responsibility. Essay 4 is similar to Essay 1 in tone, presenting a rational and structured argument, whereas Essay 2 employs a more emotional and urgent tone, and Essay 3 adopts a motivational tone focused on personal improvement.
For the chart showing both sides of the disease prevention, first we have the government responsibility. In Essay 1, the government primary individual support evidence. Support evidence is resources for epidemics, vaccine distribution, healthcare funding, etc. Essay 2, the government is full responsibility, no individual role. The evidence complex risks that individuals cannot understand, the needs of regulation and civic participation. Essay 4 is government leads, but individuals cooperate. Evidence, diagnostic technology, access to epidemiological data, national health systems, sanitation, food safety, depend on regulation, etc. And for individual responsibility, Essay 3, individuals, the primary evidence would be government, and the secondary evidence is lifestyle choices, sugar reduction, physical activity matter, local health education, workshops, and health community. Team oral reflection. In conclusion, our analysis shows that disease prevention is not the responsibility of just one group. While some essays argue for government leadership and other emphasize personal responsibility, the most effective approach emerges from combining both perspectives. Governments provide the systems and protections that individuals cannot create alone, while families and citizens contribute through informed choices and healthy behaviors. Ultimately, preventing disease is a collaborative effort that requires participation at every level of society. Thanks for your attention.